The treatment of breast cancer has dramatically changed in the last few years. Previously, the size, location, and spread of a tumor determined its treatment. Dr. Eric Weiner is a breast cancer specialist at Dana-Farber, a nationally ranked center of excellence.
We are also very focused now on the biology of the cancer, or what I often call the personality of the cancer.
When Dr. Weiner says the personality, he means in part the kinds of specific receptors on the cells which turn cancer activity on or off. There are three basic kinds that are important to breast cancer: the estrogen receptor, the HER2 receptor, and the progesterone receptor. When your breast biopsy is processed, the pathology laboratory will tell you which receptors are on your tumor. That determines the kind of therapy you get. Take, for instance, a HER2 positive tumor.
If you add Herceptin to chemotherapy in a woman who has HER2 positive breast cancer, fewer women will develop recurrences of cancer, and fewer women will actually die of breast cancer.
If the tumor is estrogen positive, hormonal therapy is aimed at blocking the estrogen receptor or decreasing estrogen production with drugs like tamoxifen or aromatase inhibitors. Then there is a triple negative, when all three receptors are missing.
These triple negative cancers account for about 10 to 15% of all breast cancer, but they actually account for a disproportionate amount of breast cancer mortality.
The Oncotype DX test measures 16 cancer genes in estrogen-positive women. These combined tests help you and your doctor decide if chemotherapy or hormonal therapy is appropriate for you. The primary therapy remains surgical removal with a choice between mastectomy, that is removing the entire breast, or lumpectomy. There's no difference in survival even after 20 years. The lumpectomy is best if the lump is small in relation to the breast. The surgeon can get clean margins free of the tumor, and the cosmetic outcome is favorable. The majority of women will have a lumpectomy with radiation to prevent a recurrence. Mastectomy is performed if the tumor is large. It's not possible to get tumor-free margins otherwise. You're at very high risk.
Where we are now is in a time when we have many more options, and what's nice about it is that these are options that allow us to give better treatment to women with breast cancer.
Breast cancer therapy has made enormous strides. 180,000 women are diagnosed with breast cancer in the United States each year, and about 40,000 women die. But that means, Dr. Weiner says, that the vast majority of women do survive.